नमस्कार, मैं हूं दिबांजलि मोइत्रा। देश में कोविड-19 के बढ़ते मामलों के बीच भारतीय आयुर्विज्ञान अनुसंधान परिषद यानी ICMR के महानिदेशक बलराम भार्गव ने ये जानकारी दी कि देश में अब तक 0.73% आबादी ही कोरोना वायरस से संक्रमित हुई। कोरोना काल के बीच भारत के लिए अच्छी खबर यह है कि दुनिया भर में कोविड-19 मरीजों की मृत्यु दर भी भारत में सबसे कम है। ICMR के महानिदेशक बलराम भार्गव ने सीरो सर्वे के नतीजों की जानकारी दी। सीरो सर्वे के बारे में बताते हुए डॉक्टर भार्गव ने कहा कि इस सर्वे से कई महत्वपूर्ण बातों का पता चलता है। सीरो सर्वे का मतलब है कि आम आदमी के एंटीबॉडी की जांच करना। इस जांच के लिए लोगों का ब्लड सैंपल लेकर IgG एंटीबॉडी की जांच की जाती है। अगर कोई व्यक्ति IgG पॉजिटिव है तो इसका मतलब है कि वो SARS-CoV-2 से संक्रमित हुआ है।
As you have mentioned that the cases per lakh population is amongst the lowest in the world as far as India is concerned if you compare to several countries across as is shown in this slide. Similarly, the number of deaths per lakh population is also amongst the lowest in the world as far as India is concerned. And this finding is actually corroborated by the serosurveillance which we have undertaken to monitor the trend of this SARS-CoV-2 infection transmission. Now, what is a serosurvey? A serosurvey, we collect blood samples from a general population and test them for IgG antibodies. And if the antibody test is positive, it means that the person has been infected in the past. And what do we expect from these serosurveys? We expect to see the percentage in the general population, who is at a higher risk of getting infection, which are the areas which need more contained efforts, which need to be strengthened. And the objective is to provide scientific guidance from time to time. And that is the purpose of this, one of the very early surveys that we have done, and multiple surveys will be done as we go on to guide. And similarly, we have been providing the scientific evidence either through the National Task Force or the Joint Monitoring Group to the government, which is the National Task Force chairman is Dr. Vinod Paul, and the Joint Monitoring Group is chairman of the DGHS, and we've been providing scientific evidence.
उन्होंने कहा, सर्वे के लिए देश के 83 जिलों के 28,595 घरों का दौरा किया और 26,400 लोगों के खून के नमूने लिए। सर्वे में पाया गया कि इन जिलों में 0.73% लोगों में ही संक्रमण के सबूत मिले।
83 districts in the country, and number of households that were visited were 28,595, and we were able to collect the blood samples and the data from 26,400 individuals. The results were that we found that about 0.73% of the population in these districts showed a prevalence of past exposure to SARS-CoV-2 infection. This means that the lockdown and the containment measures have been successful in keeping it low and preventing rapid spread of this disease over the last 3 months as we speak. However, it means that a large proportion of the population is still susceptible. And which were the individuals which were higher at risk? Risks was slightly higher in urban areas, 1.09 compared to 1, and it was higher in urban slums, nearly 1.89 times higher than rural areas. But the good news is that the infection fatality rate was very low. It was 0.08% as far as this 26,000 individuals was looking at the population.
डॉक्टर बलराम भार्गव ने बताया कि फिलहाल देश में कोविड-19 का कम्युनिटी स्प्रेड नहीं हुआ। गौरतलब है कि इस वक्त देश में कोविड-19 से संक्रमित लोगों की संख्या 2,87,000 के ऊपर पहुंच गई, जबकि संक्रमण से 8,000 से ज्यादा लोगों की मौत हो गई, जबकि 1,41,000 से ज्यादा लोग ठीक हो चुके हैं।
That is exactly what is going on. There is a heightened debate around this term community transmission.
Having said that, I think even the WHO is not given a definition for it. And as we have shown that India is such a large country and the prevalence is so low that we have found that the prevalence is less than 1% in these small districts. In the urban areas it may be slightly higher, in the containment areas it may be slightly higher. But we are definitely, India is not in community transmission, and I would like to emphasize it is not in community transmission, and that's only a term which is used, and that is what you have highlighted in your question. But we have to continue, as Professor Paul has said, and what the government has been saying, and what we have been saying, that we have to continue with the our strategy of testing, tracing, tracking, and quarantine, and continue with the containment measures as we have found success up till now with those measures, and we should not give up our guard as far as those are concerned.